HMPV surge in China. China is dealing with an outbreak of respiratory illness, human metapneumovirus, HMPV, which has raised concerns all over the globe, prompting its neighboring countries to step up their surveillance. A video purportedly shows hospitals crowded in China amid flu outbreak, reminding users of the scary COVID-19 pandemic. India has reported 3 cases of HMPV. The human metapneumovirus, HMPV, outbreak reportedly in China has raised worldwide concerns on its spread, mode of transmission, and most importantly the symptoms seen in individuals who are infected with the virus. 5 years after the outbreak of the deadly COVID-19 pandemic that claimed over 7 million lives across the globe, the HMPV virus in China is being monitored by several countries. HMPV infections have been documented nationwide in China as the government has ramped up screening, identification and isolation procedures to address unidentified infections. Various videos on social media depicted a scary scene at hospitals, with individuals wearing masks crammed into waiting areas. Frightening videos show patients coughing at the hospitals amid a spike in respiratory illness. Officials have said that China's seen an increase in HMPV cases, particularly among children under the age of 14 in northern areas, reported news agency Reuters. How's the HMPV outbreak situation in China? In light of the fact that incidences of certain respiratory illnesses are expected to increase over the winter, China's Disease Control Authority had earlier announced on December 27 that it was testing a monitoring system for pneumonia of unknown origin. According to an official statement, Reuters reported that data for acute respiratory disorders revealed a rise in total infections for the week of December 16 to 22. A video is making rounds on social media showing hospitals in China overwhelmed amid severe flu outbreak, including influenza A and HMPV, resembling 2020 COVID surge. What is HMPV and is it a new virus? Discovered in 2001, HMPV is a common respiratory virus that causes upper and lower respiratory illnesses, like a cold. As with respiratory syncytial virus, RSV, and the other seasonal diseases, it often manifests in the winter and early spring. No, HMPV is not a new virus. According to the U.S. Centers for Disease Control and Prevention, CDC, it was initially identified in 2001. But according to an expert, there is some serologic evidence that the virus has been around since at least 1958. Like RSV, HMPV is a member of the Pneumoviridae family.